For the most part, they occur when somebody's loading the knee and they lose control, either because somebody's struck them or there's a force, and the knee turns inwards and twists, what we call a knee valgus position. For the most part, it occurs in an incident involving that type of movement, because that's where the ACL is vulnerable. Often people will describe some pain, but not always. They will be aware of an unstable moment often and feel something gave way. They might have been aware of a popping. There could be swelling, which might be quite immediate or occur over a few hours. And they may get some pain, but sometimes it can happen and people are not always completely aware that it's happened. From that, I would assume that the ACL is completely torn with an ACL tear, i.e. that the ACL is no longer functional. There are more minor sprains that can occur. They usually occur over time and might be slightly more of a degenerative nature, but somebody can be aware of a bit of lack of control or some issue regarding the stability of the knee. Surgery is not always needed to treat ACL injuries. There are many people that live a full active life without surgery. Indeed, there is a case report of a Premier League footballer that continued to play Premier League football without an ACL. Some people can cope very well without them, others less so. Either way, if one has an ACL deficient knee or if one is undertaking ACL reconstruction surgery, the key issue is restoration of strength, in fact, improvement of strength around the leg, because it's the muscles that are the primary stability, offer the primary stability for the knee. The problem comes if the muscles are weak or they're out of balance. So we want to ask as few questions of ligaments as possible. And when we do want to ask questions, we want them to be easy questions. And the way to do that is to really make sure that the muscles that affect the knee are really strong. ACL injuries don't tend to heal themselves. In terms of restoration of function of the knee, it is variable. If people choose and undertake a non-surgical approach, they can get back to most of their activities often within 2 to 3 months, as was the case with the Premier League footballer that I mentioned previously. If one's having surgery, then the recovery period is significant, and to restore full function takes really about 9 to 12 months. But the knee continues to improve over the subsequent period. So one would normally expect somebody to be about 95% plus by about 12 months. In terms of Premier League footballers that have surgery, they'll often be getting back at about 9 months, but they're working pretty intensively with expert medical teams. Patients can retear their restructured ACLs. We are looking into data regarding that, but the cases vary from surgeon to surgeon depending on their reports and actually the age of the patients. But often they can be of the order of 30%, particularly in the younger age group. So we really need to work much harder to prevent recurrence of ACL injuries.